and welcome to Dr. Bowe's Pregnancy and Beyond TV. So you think you might be pregnant? Well, over the years, I've had the opportunity to speak with many women about this topic, too many to count. And I have found that women usually find themselves in one of two categories. Either they're very happy about the situation or they're not. However, both categories of women usually have mixed emotions. At first, you may be in denial, like, how could this happen to me? You may even be scared, but fearing the unknown is very real and very normal. You don't know what to expect, and you're confused about what to do. You may not know who to tell, how to tell them, or even when to break the news. You have a lot going on. But first, if you think you're pregnant, you're probably of childbearing age, and you should be taking certain vitamins and minerals to prevent birth defects and regulate your menstrual cycle. These vitamins are folic acid, vitamin B12, vitamin C, D, E, and K, as well as calcium, iron, and chromium. You should speak with your provider, that is your doctor, midwife, or nurse practitioner, about the exact dose that will be beneficial to you and your baby. So while pregnancy tests and ultrasounds are the only true way to detect an early pregnancy, there are other signs and symptoms you can look for, other than just a missed period. You may be experiencing fatigue. That means you're extremely tired all the time, and you just can't get enough sleep. And then there's morning sickness that may or may not be happening in the morning. You may be nauseous. You may even vomit at any time, day or night. There are even certain smells that you just can't stand. Well, first, your expected delivery date is calculated based on the first day of your last period. So the first few weeks, even when you don't have any of these symptoms, still count towards your 40 weeks of pregnancy. You may experience some cramping and spotting during early pregnancy from weeks 1 through 4. Everything is still on a cellular level. The fertilized egg creates a blastocyte, and that's a fluid-filled group of cells that will develop into your baby's organs and body parts. About 10 to 14 days after conception, the blastocyte will implant in the innermost lining of your uterus. And then the blastocyte will embed itself deeper in the lining of the uterus. But that could take a few weeks to complete the entire process. And this may cause implantation bleeding. Often it gets confused with a light period. That's why so many women don't even realize that they're pregnant. But implantation bleeding, it may be pink, red, brown in color. So this bleeding is usually compared to a regular menses. And when we refer to spotting, it's just a little blood present when you wipe. You may even have mild or moderate pain when you're spotting. Either way, you should always contact your provider, especially if you're bleeding or you have pain. Now, implantation bleeding usually lasts less than 3 days and doesn't require any kind of treatment. So try and get some rest, no heavy lifting, stay off your feet, drink plenty of water, and eat regular meals and healthy snacks. Please avoid smoking, drinking, alcohol, or using drugs, as these things have been linked to heavy bleeding. Please understand that not every woman experiences implantation bleeding or cramping, or even nausea and vomiting, and every woman is different with different symptoms. So once implantation is complete, your body will begin producing a hormone called human chorionic gonadotropin, which is HCG. This hormone helps the body maintain the pregnancy. It also tells the ovaries to stop releasing mature eggs each month. You will likely miss your next period, and that's about 4 weeks after conception. If you have irregular periods, you may want to take a pregnancy test to confirm your suspicions. Most home tests can detect HCG as soon as 8 days after a missed period. A pregnancy test will be able to detect HCG levels in your urine and show if you're pregnant. So take the test. If it's positive, even if the second line on the pregnancy test is really light, you're still pregnant. It just means it's an early pregnancy. And so you don't need to buy a bunch of pregnancy tests. They should all say the same thing. So if it's positive, call your provider. That's your doctor, midwife, or nurse practitioner to schedule your first prenatal appointment. If you're on medications, ask your provider whether the medication poses any risk to you or your developing baby. So if you want to know more about signs and symptoms of pregnancy, please join me for part 2 of my next video on Dr. Bowe's Pregnancy and Beyond TV. Don't forget to like my video and please subscribe to my channel. Thank you for watching.